Hello everyone, myself Monamika Nunisa. I am a student of 4th year class from Lakhimpur College of Veterinary Science. In this video, I am going to discuss about the disease called rabies. World's Rabies Day. It is celebrated on 28 September. This day celebrates Dr. Louis Pasteur's vision of rabies-free world. Its aim is to raise awareness about the impact of rabies on human and animal, and also to provide information and advice on how to prevent the disease. So first let us start with the introduction, then the types of rabies virus, host affected, mode of transmission, pathogenesis, clinical findings, diagnosis, treatment, prevention and control. Introduction. Rabies is a zoonotic disease which is caused by a virus. It is an acute, progressive viral encephalomyelitis that affects all warm-blooded animals. Dogs and cats are the source of 99% and 3 to 5% respectively of human rabies deaths. Here is the synonyms of the disease. Hydrophobia, which means fear of water. Mad dog, jalatanka, which we call it in our local language. Etiology. This disease is caused by an RNA virus named Lyssa virus, which belongs to the family Rhabdoviridae. It is an enveloped virus which is bullet-shaped in structure. It is of 180 nanometer long and 75 nanometer wide. These are the two types of rabies virus, the street virus and the fixed virus. Here I have mentioned some differences between the two viruses. So let us first start with the definition. The virus which is recovered from the naturally occurring cases of the rabies is called a street virus. And the virus which has a short fixed and reproducible incubation period is called as fixed virus. Incubation period of street virus is long, that is 20 to 60 days. And incubation period of fixed virus is constant between 4 to 6 days. Street virus produces negri bodies and fixed virus does not produce negri bodies. Street virus cannot be used for preparation of vaccines, whereas fixed virus can be used for the preparation of vaccine. Host affected. Mainly, all the warm-blooded animals are affected by this virus, such as humans, foxes, cats, dogs, jackals, mongoose, bats, etc. Rabies occur in two types. Urban type, where transmission takes place through dog. Sylvatic type, where transmission takes place through wild animals. Here comes the mode of transmission. Commonly, it is transmitted through the bite or licking of rabid animals. Secondly, through the direct contact. Thirdly, it is rare but also possible that virus can be transmitted through the non-bite exposure, which include scratches, abrasions, open wounds that are exposed to saliva. Fourthly, it can also be transmitted through the inhalation of aerosolized rabies virus, which is one of the potential non-bite route of exposure. Africa and Asia have the highest rabies burden in humans and account for 95% of rabies deaths worldwide. In the Americas, bats are now the major source of human rabies deaths, as dog-mediated transmission has mostly been broken in this region. Bat rabies is also an emerging public health threat in Australia and Western Europe. Pathogenesis. Entry of the virus through an animal bite. Then the virus will replicate in the epithelial cells or myocytes. The virus then crosses neuromuscular and neurotendinal spindles and moves to the central nervous system. The virus then invades the ganglion cells and travels up to the peripheral nerves. The virus then reaches the salivary glands, thymus, lymph nodes, taste buds, olfactory cells, and nasal secretion. The virus then damages the brainstem and medulla and infected nerve cells, which causes the paralysis of various muscles, leading to the drooling of saliva, drop jaw, which is due to the paralysis of jaw muscles. This is a picture where we can see how the virus is infected into the body of the host. Incubation period. Normally, it is 21 to 80 days, may be short, that is 4 days, or may be prolonged for years. Human rabies case has a record of more than 8 years. Clinical findings. It is of 3 forms. The first form is the prodromal form, where the animal will be having slight fever, vomiting, and anxiety. The second form is the furious form, where paralysis is rare and animals become aggressive. The acute excitative phase is pronounced, which is called as mad dog syndrome, although this type of symptoms is seen in all species. Animal becomes irritable and aggressively uses its teeth, claws, horns, and hooves. Pupils become dilated. Animals started to wander aimlessly and attempt to bite human and other animals. Dump or paralytic form. In this form, we can see the paralysis of throat and masseter muscle, dropping of the lower jaw, which is a common symptom in case of dog. Profuse salivation, animal will be unable to swallow and it will lead to coma and death. Diagnosis. This disease can be diagnosed on the basis of clinical history, signs and symptoms. The test of choice for the diagnosis of this disease is fluorescent antibody test, which can be done on fresh brain tissue. Virus isolation can be done from saliva and other secretion. Histologically, Negri bodies can be seen in the cytoplasm of nerve cells infected with the street virus. Cytological smears are to be made of hippocampus stain with the Cellar stain. Complement fixation test, PCR, ELISA can also be used for the diagnosis of this disease. Treatment. Since it is a viral disease, so there is no specific treatment. Isolation in a quiet room protected as far as possible from external stimuli to prevent spasm and convulsion. Relieve anxiety and pain by use of sedatives. Intensive therapy in the form of respiratory and cardiac support. Prevention and control. Vaccination and registration of dogs with control of stray population. Persons having bruises, cuts, or open wounds not entrusted to look after the patients. Pre-exposure prophylaxis. It consists of 3 doses which has to be given subcutaneously. The first dose is to be given on the 3rd month and second dose to be given on 4th month, and we should repeat it annually. Post-exposure prophylaxis. Wash the wound using a mild soap with running tap water over it for 5 to 10 minutes. Try to keep the injured area elevated. Slow the bleeding with a clean cloth. Apply antibiotic or antiseptic cream. Wrap the wound in a sterile bandage. Regular dressing of the bitten area should be done. A tetanus toxoid should be given intramuscularly if the wound is extensive. Non-steroidal anti-inflammatory drugs and antihistaminics should be given if necessary. Post-exposure anti-rabies vaccination consists of 6 doses to be administered subcutaneously. First dose to be given on 0 day, second dose on 3 days, third dose on 7 days, fourth dose on 14 days, fifth dose on 28 days, sixth dose on 90 days. Here I have mentioned some trade names of the vaccines such as Raksha-Rab, Novivec Rabies, Rabivac Vet, Rab-Vac, Canigen Rabies, Rabies Vet. These are the references I have mentioned here. A textbook of Preventive Veterinary Medicine by Amalendu Chakraborty, previous notes, Wikipedia, and photo courtesy Google. Thank you everyone for watching my video.